Lymphedema is a condition that affects thousands of individuals around the world. The best way to treat and manage lymphedema is with complete decongestive therapy, or CDT. My name is Kelly. I am a physical therapist specializing in oncology, rehab, and lymphedema. And in this video, I'm going to break down the main ways to treat lymphedema or swelling in the legs. Before we begin, make sure that you subscribe down below for weekly new videos. You can also join us on Instagram for more related content, and you can check out our website for more resources. Lymphedema is a chronic medical condition that is treatable but with no known cure available. Lymphedema occurs when there is a backup of lymphatic fluid, causing swelling in this body region. So how do you manage lymphedema and swelling? So we're going to talk about the 4 main components of CDT in this video, but if you want more, you can learn in-depth treatment about the best ways to treat leg lymphedema in my lower body lymphedema rehab program. This program goes highly in-depth on the best ways to treat and reduce that swelling. It includes visual demonstrations of each component of treatment, including bonus options and detailed videos with easy-to-follow handouts and more resources, all organized and packaged, combined into one program. It's everything that I use to treat my patients in the clinic, but it's put together for someone to move through at their own pace. You can learn more about this program or others on my website, which I will link up above as well as in the description box down below. But otherwise, let's talk about the 4 basic options. So the first is compression. Compression is one of the most influential and essential ways to manage leg lymphedema. Compression stockings or compression garments are specifically made to support the lymphatic system and to help avoid fluid from filling up in the legs. Before someone with lymphedema gets into a compression stocking, it's the gold standard treatment to go through 2 to 5 weeks or so of compression bandaging with a certified lymphedema therapist. The bandages are called short stretch bandages, and they are used with various types of foams and paddings to shrink the volume and the size of a leg. They look similar to ACE bandages, but they are different. You can find these special bandages online, which I will link in the description box down below. Now, once your leg is as small as we can get it, we've gotten as much fluid out of there as possible, then we transition you into a compression stocking or a compression garment. And there are various kinds of garments. So circular knit garments are elastic and usually come in ready-to-wear sizing like small, medium, large. And a standard medical grade level is a 20 to 30 millimeters of mercury of pressure, or mmHg. But it does come in various compression levels as well. So these work well for someone who has mild swelling. And if someone has more moderate to severe lymphedema, then they're going to want to consider a flat knit garment, which are usually more inelastic and usually come in more customized sizing. The flat knit garments are best for those with that moderate to severe lymphedema because they will do a better job at stopping swelling from occurring. So again, you can find links to all of these in the description box down below for different samples and my go-to kinds if you're interested. Manual lymphatic drainage or lymphatic drainage is a gentle technique used to help stimulate and guide lymphatic fluid through lymphatic vessels and out of that congested area. So it's done in a specific sequence and direction using the whole hand with a light pressure. It's something that someone can do at home if they're cleared by their doctor to do so. If one is looking for the correct sequence and technique to follow along with, you can find that on my lower body lymphedema rehab program on my website, or you can check out other videos on my channel. Exercise and movement are crucial for lymphedema management. The muscles act as a pump to the lymphatic system and to the veins. By contracting and stretching your muscles, you can help to stimulate that system to get the fluid moving. If someone has to sit or lay down for a lot of the day, either for work or what their abilities are, some of the best exercises are the following. Doing things like ankle pumps, which are bending and flexing your ankles up and down 10 to 20 times. Leg raises, so lying on your back or in a reclined position, keeping the knee straight, raising the leg up 1 to 2 feet off the surface, and then lowering it back down. and repeating that 10 to 20 times on both sides. We can try marching, either sitting or standing, marching your legs up high, alternating back and forth 10 to 20 times. And also a general movement like walking or swimming can't be beat. With swimming, the water provides a natural compression to the body, but the same as a compression stacking does. And if you're looking for other routines, I have other videos or home workouts that someone can follow along with on my channel or in my programs on my website. Lymphedema can place someone at a higher risk of getting a skin infection. The extra fluid in the tissue makes it easier for bacteria to grow, and swelling in an area for many months or even years can also cause the skin to break down from the inside out, and someone can get wounds, which also increases the risk of getting infection due to the opening in the skin. So keeping your skin and nails healthy, clean, and protected is really essential. Make sure to keep the skin hydrated with moisturizer to combat any dryness and skin breakdown. Always use sunscreen to avoid sunburns and insect repellent to minimize bug bites. We want to make sure that we try wearing protective gloves if someone is gardening or using tools, and that can help prevent cuts or scratches on the skin. But if they occur, because they will at some point, just make sure to clean the area well and apply an antibiotic type of cream with a sterile bandage over the top to try to minimize the risk of those infections. So those are the main components of leg lymphedema treatment. Be sure to check out the programs on my website for more in-depth support and resources. Treatment is not a one-size-fits-all, and it's really important to test out each of these to find out what works best for you. Again, a certified lymphedema therapist will be able to help determine which all may be best. I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.